Thank you, and good morning, Vice Chairman Dr. Burgess and Ranking Member Pallone, and the distinguished members of the subcommittee. Thank you for the invitation to testify on Louisiana's position regarding the implementation of the Patient Protection and Affordable Care Act, PPACA, particularly as it relates to exchanges and Medicaid expansion. My name is Bruce Greenstein. I'm the Secretary of the Louisiana Department of Health and Hospitals and Senior Health Policy Advisor to Bobby Jindal. Earlier in my career at CMS during the Bush administration, I oversaw Medicaid programs in the Northeast and led the federal government's efforts to reform the Medicaid programs in several states. In fact, I have two of my previous bosses here on the panel. In my current role, I have broad responsibility over an array of health service areas, including Medicaid, behavioral health, public health, and disability and aging services. Before I begin, I'd like to pause to recognize the position that we're in. It feels somewhat awkward to be here testifying on the implementation of one of the largest expansions of entitlement program in nearly 50 years, at the same time as ongoing discussions about federal spending reductions to avert the fiscal cliff and raising the debt ceiling takes place. It's a little bit of a parallel universe. Nevertheless, we are here, as you know. Louisiana has continually shared its concerns regarding the practical and policy ramifications of PPACA. Our decision not to assume the risk of building a state-based exchange is not the product of political positioning. Rather, it was made after careful analysis of the laws and regulations. Beyond the past and ongoing legal challenges of the law, we have broad concerns about PPACA's policy. While the concept of a health insurance exchange is a good one, the PPACA-defined exchanges provide for rigid federal control over coverage options available to consumers, raising costs and limiting choice. In fact, a study recently released by AHIP and the Louisiana Association of Health Plans estimates that PPACA premium tax will force policyholders in my state to pay over $2,000 more for single coverage and $4,500 more for family coverage for individuals over the next 10 years. Similar increases are noted for small and large group employers. This is a significant burden on individuals and families in Louisiana and across the country. Beyond these concerns, there are major practical and implementation hurdles. With guidance having been largely delayed or altogether missing, the October 1st, 2013 deadline to begin open enrollment seems unrealistic, considering the scope and complexity of building an exchange. The FAQs released earlier this week is certainly helpful, but is simply too little and too late. The state's decision not to build an exchange should not be taken as general unwillingness to tackle a complex reform project. Rather, the number of remaining concerns and unanswered questions simply do not give us the needed confidence. Regardless of the type of exchange that will operate within a state, there are 5 key issues fully outlined in my written testimony that need attention from Congress, and thank you for the time today, and action from HHS, including administrative simplifications and adjustments to make timelines more realistic. In addition to our concerns regarding the exchanges, we have serious reservations about blanket expansion of the existing Medicaid program without fundamental reforms to improve health outcomes and lower costs. While states now have a choice, it is not surprising that many remain reluctant. Even with enhanced federal funding, some organizations have heralded the expansion as, quote, a great bargain for states. However, state leaders must be careful before accepting the long-term liabilities of expanding a 1960s-era entitlement program. A recent Kaiser Family Foundation and Urban Institute report reveals that expansion creates winners and losers among states. Their cost estimates, which we believe actually fail to capture the full administrative costs and other impacts, they vary widely among states. For example, the New England and Mid-Atlantic states combined will save almost $16 billion in state funds over 10 years. At the same time, South Atlantic states will be paying about $22 billion more. Governors in states like Massachusetts, New York, Maryland, and Vermont combined will shift nearly $23 billion of state costs to federal taxpayers. At the same time, my state alone is projected to pay nearly $1.8 billion. And this all comes from the same report. Beyond the cost, we want to make sure we are providing individuals with access to coverage that makes sense for them, that it's cost-effective and gives them access to high-quality services. While groups like those published the report might declare victory through the simple act of handing out a Medicaid card, we know that that is simply not enough. However, I believe this administration and Congress begins to engage with states interested in pursuing market-driven healthcare reform, we can create a more sustainable and effective program. Specifically, these discussions should be driven by several tenets of Medicaid reform that include eligibility simplification and flexibilities that would allow us to keep families together on one coverage product. These points are fully outlined in my testimony, and again in even more detail in a 31-point report issued by Republican governors last summer. President Obama himself said, "We can't simply put more people into a broken system that doesn't work." He's right. Today's Medicaid model doesn't give states adequate flexibility to improve health outcomes or lower overall costs. Instead of rushing to expand, the administration should first engage in earnest discussion with states like Louisiana that are eager to further reform their existing programs now, rather than spend more money on a rigid and expensive program that will not work for all states. Thank you. That concludes my testimony. I look forward to questions at the appropriate time.
Thank you. Time has expired. Would you recognize Mr.